beautiful people. I hope that you're enjoying the holiday season. I wish to say a few words of why I think my holistic ballet program for health and happiness and for the prevention of mental disorders and for physical health and for stress management is great, and I would encourage you to try it and to support my GoFundMe fundraiser, which aims to raise funds so that I can continue to develop and implement this program as I have done in the past 3 years. And I have made great progress, and now I need your support. I wish to say that since I'm a psychiatrist and scientist, I will look a little bit at the more scientific and medical aspects of why I would encourage you to try my program and why I think it is excellent. We know that to treat psychiatric disease, we can use medications. And in previous articles on LinkedIn and video, I shared that medications which are used to treat psychiatric disease may have undesirable side effects, and I highlighted, for example, the movement disorders, tardive dyskinesia, which can be very debilitating, and that's why patients don't want to take the medications. There could be an upset stomach, there could be interactions with other medications, allergies, and also since the medications are broken down by the liver and the kidneys, sometimes they may cause these organs to malfunction. And I was thinking that there is another aspect, that taking the psychotropic medications may be associated with tolerance. And what is tolerance? Tolerance is gradually adjusting to the effect of the medication so that it no longer has the desired effect because the body adapts to it. And so the medication might lose its effectiveness, and doctors might need either to increase the dose or to change the medication, or to have such medication holidays when the patient does not take the medication for the body to adjust to the new cycle. And so, for example, this occurs with the anti-anxiety medications, the benzodiazepines, also with antidepressant medications, Prozac, Zoloft, with the stimulants which might be used for ADHD, such as the Adderall, the Ritalin, or with the antipsychotics, with haloperidol and clozapine. And I was thinking that tolerance does not develop to ballet. The more you dance, if you dance safely and you don't exert yourself, the better it gets and you start enjoying it more. And so I think this is a great advantage that ballet is a viable non-pharmacological therapy for the prevention and treatment of disorders such as anxiety, depression, and bipolar disorder, and autism, and cognitive disorders, even Alzheimer's, and it is also therapeutic in neurologic disorders such as Parkinson's disease, multiple sclerosis. And so I want to say that the ballet will not have allergies. I was thinking maybe an allergy if someone has a cold allergy and they dance in the cold. But they will have the allergy anyhow. It's not because of the ballet. And if we look, because I'm a neuroscientist and psychiatrist, and I've done a lot of lab research, and I understand that my colleagues, scientists, have the best intentions, but if we look in the past 70 years, neuroscience and psychiatry have developed a lot. A lot of advances have been made in understanding the molecular, the synaptic neurobiology, new methods to study the brain, both with microscopy and optogenetics and neuroimaging, and there is development of neuromodulation, such amazing advances, and one would think that with so much knowledge, there may be a decrease in the incidence in psychiatric disease. But if we look, for example, I looked at that, if we look at the global mortality rate, a global morbidity rate of people with bipolar disorder, the estimated number has nearly doubled in the past few decades. It has increased by 63.5% globally between 1990 and 2021. And certain age groups such as the youth and the elderly, there is a surge in bipolar disorder. Of course, that may be adjusted to, there are some differences regional, and also that now people live longer, but still there is an increase. The global rate of anxiety disorders also shows tremendous increase, especially since COVID-19, nearly 50% anxiety disorders have increased from 1990 to 290. And again, certain groups such as youth, young adults, and women show greater incidence, and especially the youth and the young adults and women could also dance ballet. And the absolute number of people living with depression worldwide has increased by 88.5% from 1990 to 2021. And again, adolescents and youth show very high incidence. And the global number of people with drug use disorder has increased. And what is even more disturbing, there are more deaths. Maybe because people think that the drugs are more potent, and we know about the opioid crisis, and my search show that cannabis and stimulants also contribute a lot. And we also know that autism rates are increasing, and in dementia is increasing. So this is incredible that although there are such advances, we can't treat the psychiatric disorders or prevent them, and they're actually increasing. Maybe this takes time. Drug companies are working intensely to develop medications, but until the effective treatments and prevention exist, we need to have alternative non-pharmacological treatments, and Ballet is an excellent alternative. And I know I have tried it myself because in my early 40s, when I didn't dance regularly, and I had a lot of stress with job search, and my father was suffering from Alzheimer's, I started to develop breathing difficulties, heart palpitations. I had ECG done, and there was nothing organic, so that was an anxiety disorder. And when I started dancing, I don't have these symptoms, thankfully. And what I showed is not for all medical specialties and disorders. For example, in pediatrics and neonatal care, medical science and medicine have made advances because of the knowledge. And my search showed that the deaths at birth and infancy have decreased globally. And the under 5 mortality rate has fallen by 61% since 1990. And this is attributed to the immunization and sanitation and better neonatal care and maternal health. Of course, there are some regional disparities. Also, if we look at cardiology, in the past years, the mortality from cardiovascular disease, such as heart attack or stroke, has decreased significantly in the US. However, the chronic diseases of the heart and the cardiovascular system have increased, such as heart failure, arrhythmias, and hypertension. And the reasons may be different. For example, some reasons for improvement and decrease of the mortality rate may be better public health, medical advances with blood pressure medications and cholesterol lowering drugs and early detection and better emergency care. But perhaps the increase in chronic disease is linked to obesity and diabetes and maybe other factors that I won't go into. So it's not for all medical specialties that the rates are increasing. Psychiatry is more spatial. Human beings are social, and so besides the biological factors that science studies and drugs are developed based on, there is the social aspect, which is very important. And so I hope that you found my introduction informative and that you would like to try my ballet program. Here is my favorite ballet students primer, and you would like to subscribe to my YouTube channel and support my GoFundMe campaign. Support Genevieve's Ballet for healing with joy, art, and science. And if you have any questions, please ask can find me on LinkedIn. Thank you so much. Wishing you health, happiness, and safe